you thinking about starting your own PAS agency in Texas? Well, you are in the right place. This guide walks you through exactly what it takes to get licensed, get launched, and get profitable in one of the fastest growing industries in the country. Well, let's start with some good news. The good news is personal attendance services, PAS. It's one of the most in-demand business models across Texas and the US. There are over 73 million baby boomers either currently receiving or soon will be needing in-home support. Demand is high and it's rising. And this means there's real opportunity for aspiring agencies like yourself who can execute with the right structure and guidance. Well, let me introduce myself. My name is Shay. I'm with 123 Consulting Solutions. We've been around since 2011. I personally owned a multi-million dollar home care agency, and now I help new agencies launch and grow with confidence. If you want to know how to do exactly this, from the licensing, marketing, staffing to operations, this guide is your starting point. So let's start. What is PAS? PAS stands for Personal Attendance Services. In Texas, it falls under the Home and Community Support Services Agency. In short, HCSA. That's the license type. And this is issued by the Texas Health and Human Services Commission. Outside of Texas, though, PAS is often referred to as non-medical home care, personal care, or private duty care. These services help individuals remain independent in their homes by supporting their daily living tasks without the need for medical care. PAS agencies in Texas. PAS agencies provide assistive services to individuals who live a home in their private homes, independent living apartments, assisted living communities. Many individuals choose PAS care because they want to maintain their independence and they want to avoid institutional settings. The key is offering help that respects their lifestyle, their privacy, and their dignity. Texas home care agencies generally fall into one or more of the following categories. Private pay agencies. These are clients who pay out of pocket for care. Home health agencies. They offer both skilled and non-medical services. Medicaid funded agencies. They serve clients referred by caseworkers and state Medicaid programs. Agencies with MCO contracts. They work with providers like Superior, Molina, AmeriGroup, United Healthcare, and the VA. Years ago, home health agencies provided most of the in-home support. Today, private paid non-medical care has carved out its own space, and many new owners are choosing to specialize just on that alone. What services do PAS agencies provide? The services provided by PAS agencies can be divided into two different types. We have number one, activities of daily living, ADLs. So these include personal care tasks like bathing, dressing, eating, feeding, toileting, walking, transferring from bed to chair, chair to wheelchair, taking medication. Number two, instrumental activities of daily living, IADLS. These support independent living, and these include meal prep, light housekeeping, running errands, grocery shopping, medication reminders, and transportation. So I know you're asking yourself, how do PAS agencies get paid? Well, let's talk about this question. So how do they get paid? The good news is there's several ways to get paid. That's the best part of this. You can get paid from different sources. Let's go through this by focusing, first of all, by the most lucrative down to the least lucrative payer. So VA clients, this is the veterans, the best paying clients. You can get paid from $30 to $35 or even more depending on your location. Private pay clients, this is the second best. The rates range from $25 to $30 to even $40 depending on your market. Long-term care insurance, these pay directly or reimburse families. Managed care organizations, the MCOs, these are often lower rates but often will offer a more consistent referral stream. Medicaid. Medicaid pays for services provided for low-income individuals. The rates are changing soon from a low of $13 to $17 an hour, but the annual rate enhancement is going to go away. So that's one thing about that. The state Medicaid program allows these services to be provided by the client's family, with the hour wage starting from around $13. A state proposed change from the 1060 previously was. So it used to be 1060. I think they're proposing now to make it $13. So where do you start from? Step one, decide who will be your administrator and your alternate administrator. Before you start, you have to know the requirements for opening a PAS agency. HHSC states that you will need an administrator and an alternate administrator just in case you or whoever is the administrator is not available to care for the clients or to attend the state survey. So, what are the administrator qualifications? Well, the good news is both the alternate administrator and the administrator, they have to meet the same qualifications. So you can either be a physician, an RN, a social worker, or a licensed nursing facility administrator. Or you can have a high school diploma, a GED, or one of the following: either 2 years of supervisory experience in a health related setting, 1 year of caregiving experience, professional or family based, or 2 years of full time study in a health related college program. So we can do that too. Make sure both individuals meet this criteria before you move forward. Very important. Step two, choose a strong business name. I have assisted tons of clients who come up with the most interesting names, to say the least. The problem is the name they choose either becomes a hindrance or it isn't a marketable tool. You have to always keep this in mind. From the time you start your agency, you are in this for the client, not in business for yourself, but the clients. So your name needs to reflect this. Some home care owners choose family names or they use names that has nothing to do with what they're doing, with what the business is about. I think this is a big mistake. Instead, always keep your clients in mind by using names that they can easily remember. That's very important. Tips for choosing a name. Okay, so clients always ask me, so Shay, what's the best way to come up with a name? Well, first of all, coming up with a name, you want to make sure it's easy to remember, easy to pronounce, to spell, and associate with home care. You need to include terms like home care or personal care services to boost SEO and search visibility on Google. I advise you start with an A or a number like 123 home care. This gives you a listing advantage on referral booklets that are sorted alphabetically. Step three, register your business entity. You need to go to the Texas Secretary of State website. When you get there, you're going to have to create an account. You're going to search for available names. I advise you also check Google. I have come across names that weren't in the Secretary of State website, but showed up in Google. And this will affect clients trying to find your company when they do a search on Google. Okay. Then once your name is not available on the Secretary of State, you need to register your business structure. There are various different business structures you can choose from. You have the LLC, which is popular for tax flexibility and liability protection. We have sole proprietorship, which is easy to set up but offers the least protection for your business. Then we have corporation, S Corp or C Corp. This is more structure and more regulation. So the type of business you form will determine how much tax you pay, what kind of organizational structure your business will have, and the personal obligations you will have to assume as a result. Pro tip: home care startups benefit from starting as an LLC. Well, this is because you pay the least amount of taxes until you cross about 75 to 80,000 in net profits. Then it will be smarter to switch to an S corp, not a C corp, an S corp. But always speak with your accountant to confirm what's best for your goals. Step four, get your EIN, get your employer identification number. You need to visit the IRS EIN portal to obtain your company's employer identification number. Okay, it's really easy. It takes less than 5 minutes to do. Fast, free, and required for your banking, for your taxes, and for your payroll. Step five, decide your company address, phone number, domain name, and email address. Starting out, many PAS agencies start from home, and this is good because you want to reduce your cost and also for convenience. If you can save some money, why not? If you plan on using your home, though, you have to dedicate a space in your home specifically for the office, and it has to be comfortable enough for the state surveyor to come in and operate from when they come over and do a survey. So keep that in mind. So you'll need a few things here, okay? You're going to need a dedicated phone line, okay? So you need to be mindful of the fact that this is a phone line that you're going to receive calls from clients, state surveyors, employees. It will not be convenient, and actually it will be bad for business to use the same number that you use to answer your family calls, okay? So you can't use your private line. So I definitely advise you to get a dedicated phone line. You can, however, to solve this problem, you can use an internet phone line, for example, like RingCentral. That's what I use. So this RingCentral gives you a dedicated phone number and an app you can use to answer phone calls. Next, a business domain name, right? So getting a business domain name for your website is quite easy, right? You can just visit platforms like Hostinger.com or GoDaddy.com and search for a domain name that represents your business, such as abchomecare.com, for example, right? Once you secured your domain, these companies also allow you to set up a professional email address. Your email address, what you need to do with that though, because we're trying to build a professional entity here. So it's important to use an email address that reflects that. I'm often surprised to see agencies use Gmail or Yahoo email addresses. It doesn't look professional. Instead, register an email like info@abchomecare.com, not abchomecare@yahoo.com or gmail.com. No, definitely not. A professional email leaves a lasting impression and aligns with your brand. Step 6, complete required training. Before you submit your application to the state, the administrator and the alternate administrator must complete a few things. So we have the CBT, the computer-based training. Your PAS license will need you to do 3 modules, the modules 1, 2, and 3, and you need to save the certificates and sign them, and then upload them to Tulip, which we're going to discuss in the next section. Also, you will need to take the Texas Administrator 8 class, okay? So once you have the certificates from the CBT modules, the administrator and the alternate administrator will need to complete the Texas Administrator A class, which you can take from our website, 123 Consulting Solutions. Use our coupon code. We have a coupon code on the website that gives you $10 off, okay? Okay, so next, what you're going to do is you're going to print out the 2 certificates for the administrator and the alternate administrator, and you're also going to upload that to Tulip too. You need to have 24 hours of initial training for the first year, but for the sake of getting your license approved by the state, you only need to do the Administrator 8 class. So you only need to upload the Administrator 8 certificates for both the admin and the alternate admin. Step 7, create a Tulip account. So next you're going to go to Tulip, the Texas Unified Licensure Information Portal, and create your agency account. You will need to complete the information required on the application portal, and then you're going to move on to the next step. Step 8, application submission. Before you submit your application, you will need to upload these following policies. The first policy is the policy about the organizational structure of your company, your organizational chart. Then also the policy on transferring a client or closing your agency. Also, a plan for continued education of the administrative staff. HHS wants to know that you have a structure already set up. You can download templates for free at 123consultingsolutions.com. Once your policies are ready, upload them into Tulip and pay the $2,625 application fee. Yes. Then going forward from here, you will have to renew every 3 years. So the license is, it's kind of expensive, but it lasts for 3 years. Previously, back in the days, it was only for 2 years. Expect HHSC to review your application and submission for 45 days. As long as you've done your part, you have no mistakes in the application, it shouldn't take longer than 45 days. While you wait, prepare to launch. So there's a few things you should do. Step 9, open your business account. I'm going to advise you open a business account that has 4 sub accounts in one for several different reasons. And I'll go through this. You're going to have one account for payroll. The second one is for owner compensation for yourself. Third one is for taxes. And fourth one is for business reinvestments. Okay. We're going to revisit this in a different topic in a future class on our YouTube page. So remember to subscribe so that you do not miss that. Step 10, build your website and your logo. You need to create your logo on your website. Okay, so these days it's beautiful because there's so many inexpensive ways to get a logo made for you, or you can make one yourself using canva.com. If you'd like to hire a professional, just head over to fiverr.com and find a reasonably priced one for maybe $25 to $50. Your website is your digital business card and needs to express exactly what your company does. And it has to be easy for the user to understand and to find information. Keep that in mind. So they need to be able to find information they need quickly. So do not convolute your website with all this information. No, we don't want. We want to keep it really simple. So your website needs to clearly explain who you are, what services you provide, where you serve, and how people can contact you. We're going to have a masterclass where we're going to teach you how to create an effective website that helps you to get leads and grow your email list. Okay, because that's the whole reason you have a website is to get leads. That's the main reason. Step 11: set up your Google business profile. Okay, so this is absolutely critical. If you want your agency to show up when somebody searches home care agency, or sorry, home care near me, or caregiver for mom in Houston, Texas, your Google business profile is the single most important thing you can set up. Why does this matter? Well, for several different reasons. For one, free exposure on the most used search engine. Okay, it also allows you to collect 5-star reviews, which boost your ranking. Many times your potential client will call directly from there without even having to visit your website. That's why you need to have a Google business profile. Fun fact, guys, 90% of consumers, they read reviews before making a purchasing decision. And most will go with an agency with the most 5-star ratings and reviews. So collect as many of those reviews as possible from your clients, okay? So to set this up is quite easy. Just go to google.com/business, okay? You're going to create an account or use your agency's email. You're going to enter your agency's name, which must match exactly as it appears on your website. You're going to include your service area, select your cities or your zip codes, or the zip codes you serve. Include your physical address, which can be hidden if you work from home. Include your phone number and include your website, okay? Choose home care services as your primary category so Google can easily index you. Include your business hours, include some photos, and a short description of what you do. You need to verify your listing. So you need to do this by usually postcard sent to your business address. Google requires you to do this to make sure that's your real business. Pro tip, link your Google business profile to your website. This helps to build trust and improves your ranking on Google. Step 12, purchase your policy and procedure manuals. Okay, there's quite a few policies that you need to get. So I would say just come over to our website and get them. You need the PAS policy manual, emergency preparedness plan, QAPI binder, your satisfaction survey, employee handbook, employee binder, and client admission packet, complaint and infection control binders. We have all these on our website, so reach out to us and we'll get them customized for you. And I'll actually go through them. We have people who are actually going to go through them with you and review them with you. Okay, step 13, develop your recruitment and retention plan. While you're waiting for your license, spend time finding quality staff and training them in anticipation for your big launch. You will need at least 2 good caregivers on board so that when you do have a referral, you aren't just running around wondering how to staff the clients. You can hire, onboard, and train your caregivers on this website, telescopehr.com. Okay? Automate the process. Automate the process. So you need to train your caregivers on a few things. The state requires you to do this, okay? On emergency preparedness, client safety, infection control, activities of daily living, and HIPAA compliance. You need to, from the beginning, make caregiver quality part of your brand from day one, okay? Make sure you train your caregivers. Step 14, set up your operation systems, okay? So you need to build your back office systems. You need to get your payroll. You can use Gusto, you can use ADP, QuickBooks, billing, Stripe, Vanco, to name a few private pay billing systems. Scheduling, Telescope, AccessCare, WellSky, SwiftOps are common scheduling systems. Timekeeping. Well, the same applications that do the scheduling can also be used to clock in and clock out. Same ones we talked about, the Telescope, AccessCare, WellSky, Alora. I tell my clients, you need to have systems in order to grow your business. When you start, 80% of your time should be dedicated to either getting new clients or building relationships with those who can refer clients to you. Automate everything else. Automate, delegate, okay? Clear that off your table. Avoid these common mistakes. Submitting incomplete policies. Make sure you complete the organizational chart by putting the name of the administrator or the alternate administrator in the different rows in the chart. Under the client section, you do not have to put anything there, but every other field needs to be completed. And also, don't take too long building relationships, okay? Building relationships with referral sources. While your Tulip application is being reviewed, you should be working on your sales and marketing strategies. I recommend working on a few things here, okay? You should already, before your application gets approved, get your 250 business cards printed, get your website completed, get your marketing scripts together, prepare a 30-second elevator pitch, start a Facebook business page, and post weekly value-based articles and videos. And also post this on your website too. You have to be consistent with this because Google and Facebook, they reward you by ranking you higher on their website when you're consistent. What to do after you get your license? Okay, announce your launch. Aren't you excited? You're done now, right? You know, say, got your license. It's time to run. It's time to put the pedal to the metal. So you're open for business. You're going to post on your personal and business social media pages. You're going to send texts and emails to your friends and family, asking them to connect you with at least one person who can help your business. This could be a social worker or a discharge planner or anyone who works with seniors. This is how you build your first referral sources, okay? Set up your Medicaid MCO or your workers' compensation contracts. If you plan on accepting Medicaid or MCOs, you will need to enroll in TMHP. You need to apply for contracts with United Healthcare, Superior, Aetna, WellPoint, to name a few. You can also reach out to paradigmseniors.com to set up your workers' compensation so that you can receive workers' compensation clients. Next, begin your marketing. This part is very, very deep, so we're going to have to discuss this in depth in another video. Prepare for survey. You will need to send in your survey readiness form 6 months from when you get your license approved. So you need to make sure you have your policy procedure manuals already. Make sure you've completed the different forms here. For example, the emergency preparedness, the quality assurance performance improvement binder, and other required documentation before the announced survey. I go through that with you too. So, and also you do not have to do this alone. Starting your own agency is very exciting, but it's also very overwhelming and time consuming. And that's why we're here. At 123 Consulting Solutions, we help you with every step of the way. We're talking about from the application and licensing support to the policy and procedures manuals to Medicaid contracting. Also, when it comes to marketing strategies, also workforce and development and retention, we do all those things. Please click on the subscription link for more resources and give us a call to learn how we can help you launch your agency the right way. Your dream is possible. Let's build it together.